Hello students, in the lecture series of osteology of the upper limb, previously we have discussed osteology of the scapula bone and the clavicle bones. Today in this video we will discuss the osteology of the humerus bone. Humerus bone is the longest bone of the upper limb and it is located in the arm region. The upper limb has shoulder region, arm region, forearm region and the hand region. The scapula and the clavicle form the shoulder region. The humerus bone form the arm region, while the radius and ulna form the forearm regions, while the carpal, metacarpal, and the phalanges form the hand regions. Now, following the humerus bones. The humerus bone is proximally connected with the scapula at the glenoid cavity and the head of the humerus bone, forming the glenohumeral joint, while distally the humerus bone is connected or articulate with the radius and the ulna bones. Now discussing the humerus bone further, humerus bone has proximal extremity. This is called the proximal extremity, which articulates with the scapula bone and the body or the shaft, while distally this area is called distal extremities, which articulate with the radius and the ulna bones. Now further discussing the proximal extremities of the humerus bones. In the proximal extremities we have head region, anatomical neck, greater tubercle and lesser tubercle, intertubercular groove or bicipital groove. And surgical neck. As you can see, this round portion is the head of the humerus. This portion articulates with the glenoid cavity of the scapula. Now inferior to the head of the humerus, this constructed region is called anatomical neck. Now laterally of the humerus bone, this greater rough elevation is called greater tubercle, and medially to the greater tubercle, this less rough elevation is called lesser tubercle, while the groove between these two tubercle, as you can see, is called intertubercular groove. Here the tendon of the bicep femoris muscles passes. Now inferiorly to the tubercles we have another constructed region which is called surgical neck. This region is called surgical neck. The surgical neck is more prone to the fractures and the axillary nerve passes through this region, through the region of the surgical necks. Now coming toward the body or the shaft of the humerus bone. The shaft of the humerus bone has deltoid tuberosity, spiral groove, medial supracondylar ridge, and lateral supracondylar ridge. Deltoid tuberosity, spiral groove, medial supracondylar ridge, and lateral supracondylar ridge. This elevated region located laterally is called the deltoid tuberosity. this region. This rough elevated region is called deltoid tuberosity. Here the deltoid muscles of the shoulder is attached. The tendon of the deltoid muscle is attached with the at the point of the deltoid tuberosity. Now posteriorly this groove, as you can see, this groove is called spiral groove, and here the radial nerve passes through it. Laterally, this is the deltoid tuberosity. This rough elevated region is the deltoid tuberosity, while posteriorly this groove is called spiral groove, where the radial nerve passes. Now this region, a slight ridge, you are seeing this narrow ridge that arises proximally from the medial epicondyle is called medial supracondylar ridge. This is the medial epicondyle, and the ridge arises from this is called medial supracondylar ridge, and same this is the lateral epicondyle, while the ridge arises proximally from this region is called lateral supracondylar ridge. So the body of the shaft has medial supracondylar ridge, lateral supracondylar ridge, laterally deltoid tuberosity, and posteriorly spiral groove where radial nerve passes. Now coming to the distal extremities of the humerus bones. Distal extremities mean that lies distally. We have medial epicondyle, lateral epicondyle. As name indicates, it is located medially and it is located laterally. Capitulum, trochlea, and we have three fossas: coronoid fossa, radial fossa, and olecranon fossa. Now coming toward the bone. This is the anterior view of the humerus bone. This is the exact anterior view. Okay. This round elevation here, this small round elevation here is called lateral epicondyle, which is proximally mean above to the capitulum. This is the capitulum of the humerus bone. This capitulum is small round shape, and this articulate with the radius bone. As you can see, this is the capitulum and this is the radius bone. The radius bone articulate with the humerus at the capitulum region, and above the capitulum we have lateral epicondyle. This epicondyle is small round shape. Okay, and here this is the medial epicondyle. The medial epicondyle is large noob shaped structure or elevation which is proximally or above to the trochlea. This region is called trochlea. This is in pulley shape. This trochlea articulate with the trochlear notch of the ulna. This is the ulna bone, as you can see, this is the trochlear notch. This area is called trochlear notch. Here the trochlea articulates. So this trochlea articulate with the ulnar bone at the trochlear notch. Now coming toward the fossas of the humerus bone that is located in the distal extremities. This fossa, which is located above the trochlea, is called coronoid fossa, while this small fossa, which is located above the or proximally to the capitulum, is called radial fossa, or simply you can say the fossa which is above the radial bone is called radial fossa, or radial bone and or radial fossa. Now posteriorly, this fossa where the olecranon process of the ulnar bone articulates, or it is fixed into this fossa. This fossa is called olecranon fossa. This is the ulnar bone and this is the olecranon process. This is the olecranon process that is fixed into the olecranon fossa of the humerus bone.